Good afternoon. My name is Gino Johnson with CapSite. We're a Burlington, Vermont-based research and advisory firm, and wanted to talk just a little bit about a health information exchange study that we completed and published recently. Really quickly, background on CapSite. There are a few different services that we provide to the market. One of the core competencies for CapSite is we have a unique database that is providing transparency on healthcare technology pricing and packaging. We cover about 150 different categories, from things such as HIE, EHR, as well as imaging technology, imaging equipment, and really providing transparency across both the healthcare IT area, as you can see here, imaging equipment and medical devices. And we also have a core competency around providing insight into the market opportunity, market share, through our strategic industry reports. Each year we publish about 20 strategic industry reports, one of them being the health information exchange study I'm going to discuss today. You can see some others here where we have published around the ambulatory EHR market or the imaging IT market. To move into the health information exchange study, when we do our studies, our goal is to get to a statistically significant sampling. And for this study that we published in December of last year, we had a sampling of about 350 hospitals across the U.S., which makes that a statistically significant study. You can see here the geographic distribution across the U.S. The participants in the study were the hospitals and health systems. So while there were some regional HIEs and some state-based HIEs, our view and really our assessment of the market is that the majority of the activity in this space, the majority of the spend in this space will be across the hospitals and health systems, and you can see that was the majority of the participants in the study. We also looked at the market segments that participated in the study. So there were a number of organizations that participated that were in the under 200 bed market segment, the 200 to 400 bed market segment, just to give you a little bit of visibility into where those organizations were in terms of the size and the market segment that they're in. The first thing we were really trying to understand in this study was, are these hospitals and health systems currently part of an HIE? And really looking at sort of on the spectrum of how many have joined up and formed an HIE at this point. We found about 80% of the organizations are either part of an HIE or are going to be joining an HIE. And you can see here about a third already were at the point of the study. The study was, as I mentioned, published in December. The research was done in the late October, early November timeframe of last year. When we spoke with and interviewed the organizations, these were a number of the HIEs that many of you are familiar with, I'm certain, that came up in the study. So whether it's the high-profile Indiana Health Exchange or in our area in Vermont, Vital. These are just some examples of the HIEs that organizations that we studied were working with, had joined, and were interacting with. And here's just some others in some other parts of the country. One of the other core objectives for the study, we were trying to understand where is the market at in terms of adopting some of these HIE technologies. We worked with a number of the HIE technology providers within the space and a number of the healthcare providers to define a set of classifications for HIE technologies. And the first classification was a set of infrastructure and core services. Within that classification, there were things such as MPI, patient and provider indexes, authentication, record locator. And the way to interpret this slide is, again, out of the 350 hospitals, we found about 70 of those hospitals had made an investment in an MPI. So that translates to about a 20% adoption of that HIE technology. And again, you can see from authentication, about 40 out of the 350 hospitals. So it gives you an idea as to what for the core infrastructure HIE technologies the adoption has been to date. The next classification was around value-added service layers, and within that grouping we had things such as e-prescribing, things around immunization reporting, physician portals, and PHR. And again, here you see significant uptake and adoption around e-prescribing. 90 out of 350 hospitals indicated they had made an investment within the context of HIE in e-prescribing. And again, you can see what the levels of adoption are across those other HIE technologies within this value-added service layers category. And the last grouping, one other quick point here, when we ask these organizations, have you invested in this HIE technology, we defined recent as 2009, 2010, and 2011, so just to clarify the time frame there. The last classification was around connectivity, and within that grouping we had things around results reporting, referrals, as well as order management, and you can see here a lot of investment and adoption around results reporting and delivery, with about 100 hospitals out of the 350. And this is that entire view together. So this is, again, a look in the rearview mirror of the investment and adoption of those HIE technologies that have taken place to date. And this is just a different way to show that, not in terms of absolute respondents, but in terms of the adoption percentage. So again, about 20% adoption of MPI, master patient indexes, about 25%, a little more than that for e-prescribing, and then almost 30% around results reporting. So those are some of the highest levels of adoption for these HIE technologies to date. The next area, we really were trying to understand what's the big picture look like, and so we asked these organizations, what year, when did you make these investments? And within this market, the HITECH Act has been driving through the stimulus funding significant investment in not only EHR, but now HIE technologies, and you can see a very clear trend here, and not a coincidence that this is sort of tracks along with the high-tech stimulus dollars. So you've got nice activity increase from 2009 to 2010 to 2011. We do about 20 of these studies a year across imaging equipment, across ambulatory EHR, across smart infusion pumps or emergency department information systems. And what we see is anywhere in a range of 17% to 35, 36% of hospitals indicating they plan to invest in a given technology. In this study, we found 3/4 of the market indicating they plan to invest in HIE technology. So off the chart, and you see that here with, again, in context with some of the other study and some of our other findings, where you have, whether it's ED systems, about 30% of hospitals, or PACS, image archive solutions, that about 20%. So our view, again, is that the HIE market is going to be very, very active as you look at the next 18 to 24 months. So what are they going to be spending, and what are they going to be investing in? This gives you a look forward. So we ask the same question, not only what have you invested in, but what are you planning to invest in? And you see here there's going to be significant investment in MPI, significant investment in e-prescribing, significant investment in immunization reporting. So these are the areas that are going to represent the most significant opportunity for HIE investment based on the shopping list over the next 18 to 24 months for hospitals and health systems as they move towards health information exchange. And this is time frame, looking at, again, a lot of activity within the next 12 months. We always take with a bit of skepticism the certainty with which investments will be made beyond the current fiscal budget year, but nonetheless, you see some activity in that 12 to 24 month window as well. We're also trying to understand, are they planning to engage a professional service or consulting firm as they look to invest and look to implement these HIE technologies? We found about 16% indicating that yes, they do plan to engage a firm. Our view, my view, is that that's actually going to be higher than that as they get into it, roll up their sleeves, and realize some of the complexity of these HIE technologies, that it's actually going to be higher than that. But nonetheless, we found about 16%. We also were trying to understand, for those organizations that have made an investment in HIE, who are they working with? So who did they partner with as their primary HIE vendor? This is a fascinating and very dynamic, it's also a very fragmented market. And the day that we published this, Siemens had made an acquisition to acquire MobileMD. Within the last year, you've had other acquisitions. Obviously, United Health and Ingenix acquired a company called Axolotl, which subsequently has been rebranded as Optum Insight. You had Harris acquiring CareFX. You had very significant acquisition by Aetna of Medicity. We believe, given the spend, given the activity in this space, that there's going to be continued consolidation in this market, and there's probably some other activity that I've neglected to mention, but nonetheless, there's already been considerable activity. IBM with Initiate Systems about 2 years ago with a MPI solution that's very active in this market as well. So that's what we found in terms of a market landscape, market share for the HIE market at this point. And then this is a look back at, for those organizations that have invested in HIE, did they partner with and engage a professional services firm? And we found about 20%, about 5% for implementation help, about another 15% for their pre-selection, vendor evaluation part of their process. One of the big takeaways from this research is that these health systems and hospitals need help. There's a really tremendous opportunity, whether it's a consultant or you're a HIE solution provider in this space. There's a lot of uncertainty, and this is one of the takeaways here is just the opportunity for really partnering with these hospitals and health systems to help them figure out how to navigate through investing and adopting HIE technologies. One of the other areas that we were looking at was just trying to, what is the driver for these organizations to join an HIE? For about half of them, it was really about improving in terms of efficiency for the requirements under meaningful use, part of the HITECH Act and the stimulus dollars there. But for 20%, it was about connecting to the community. There are some interesting differences as you move through the different market segments here. In the under 200 bed segment, it was much more about meaningful use stimulus dollars, much less about connecting to the community. In the over 400 bed, where you have many academic medical centers, where you have many early adopter, it was much more there about connecting to the community, less about the meaningful use stimulus dollars. So definitely some differences as we moved through segmenting the findings across a different set of organization types and size, if you will. And then here's another example of the uncertainty and some of the assistance that exists that we found. We asked these organizations, are you planning to participate in an ACO? Now, full disclosure here, when we did the study, the final rules relative to CMS's ACO had not been published. But nonetheless, we found about 26% of these organizations did have plans to participate in ACO, and this will be something as we launch our follow-on study here in about 3 weeks to measure what is the sentiment out there in terms of plans for participating in ACO going forward. Another area here is as you think about the goal of health information exchange, where you have disparate environments, whether you might have a EHR from Cerner or an EHR from Siemens or Epic, and the ability to share between those disparate environments across a state, across a community, the ability to share information with non-owned entities in those disparate environments is going to be a really important area for success if the goal of the stimulus dollars and the goal in the market is going to be successful. So we asked these organizations, how are you going to approach information sharing and data sharing with non-owned entities? And we found about half are going to set it up as view only, and then another about 20% are going to handle it through bidirectional publication of that data. So this will be very interesting, and a lot of the work that's underway to develop standards for HIE is really going to be very important to enable the success that sort of is envisioned and is really the goal of the stimulus dollars, if you will. That's part of HITECH. So that was a look of how do you today. So for those organizations that are doing this now, this is a how will you. So if you're planning to invest in these, how are you planning to approach data sharing with non-owned entities? And again, you can see even more than half here are not sure exactly how they're going to approach it. So again, just a real opportunity if you're in this space with a solution or as a solution provider, an opportunity to really partner with these organizations to help them as they try to navigate through, whether it's joining an ACO or how to handle data sharing with unknown entities. There's a number of indicators here. We also try to understand for the organizations that are planning to make investments, who's top of mind? Who are they going to consider in this space as they start to either budget for those HIE or as they kick off their vendor evaluation projects? So this is what we call mind share. And what we found is, some interesting findings here relative to some EHR companies in the space, whether it be Cerner or Epic or Siemens, or some of the HIE vendors that have made some progress in sort of early movements here with Medicity, for example, or Relay Health, which as a subsidiary to McKesson, and really you can see that Relay Health mind share in part is a direct relationship and a direct representation of the McKesson market share in the really across all segments of the market today. So this is what we found in terms of market share. There are some differences as you move through the very low end of the market. Cerner and Epic mind share drops off a little bit in the low end of the market, but it also, when you move up into the largest segment of the market, over 300 beds, over 400 beds, the Medicity, the Optum Insight, Axolotl falls off a bit, and there you have even higher market share, higher mind share for the EHR companies, Cerner, Epic, and so on. So that really was the key findings that we wanted to cover in terms of the HIE study. Again, we are going to be publishing a follow-on study to that. We're going to put it in the field in about 3 weeks, run it for probably a month. So within the June timeframe, we'll be publishing our follow-on study. I'm happy to answer any questions from anyone relative to our findings or our methodology in the study. Great question. I think it depends. I think I'll offer a couple of comments here. So you have, sure. So do I really think that HIE companies are standalone companies? Is that fair? So I think it's interesting because you have, I'll sort of speak about maybe 4 companies, and not that there aren't a lot of companies, there certainly are, but I think you have some different models here. I think you have the Cerners and the Epics of the world that sort of come from a strength and base 20, 30 years, and I'm no allegiance or not trying to ignore Siemens and McKesson and others, Meditech, but from a EHR standpoint, from a Cerner and Epic, there is a real interesting dynamic because you have an environment where in many cases they want their solution to be everywhere, not only in that health system or in that hospital, but out into the affiliated physician environments and as much as they can across the state. So there's a little bit of a conflict there in terms of willingness and cooperation, if you will, that I believe the standards is going to help. And so I think you have the environment where you have sort of one profile of a vendor in the HIE space that is a Cerner or an Epic, more of a traditional EHR solution provider. And then maybe you have the Relay Health or the Medicity or the Optum Insight. I do believe, to answer your question directly, that yes, they are an independent and there is a market, a viable market for those independent HIE vendors. The dynamic that I see that's going to be interesting is how do we drive towards this better environment where you can share across systems and you can share across disparate environments. So that's my view. I don't know if that answered your question.
It strikes me that HIEs are features and functionality. They're like middleware.
Yeah.
So to that extent, I don't consider Cerner or Epic as HIE companies. They have features and functionality in their EHR that have the middleware component, which I think is HIE. If you look at standalone like DB Motion, or if you look at
Sure.
Ability, or Medicity, or even these others, they are no longer standalone companies. They're subs of someone else. So there are very few standalone pure HIE companies, and they're all disappearing because they're either being acquired or Cerner and other are creating their own HIE features and functionality in their next release. So that's the basis of the question of whether there's really a standalone HIE business.
No, I think it's going to be fascinating to watch, and you're absolutely right. There has been consolidation. I believe, again, as I mentioned, there's going to be continued consolidation in this space. And I brought this slide back up because I think as you look across this portfolio of HIE technologies, you have some niche HIE companies, and then you have some other companies that offer the majority or maybe all of these HIE technologies. And you have, as you described, I think you have some situations where there are VAR relationships or even white-labeled relationships where you have some HIE technologies that's sort of under the covers of one of the core EHR companies. And the question is that a sustainable model for them? Time will tell. So, but it's going to be fascinating to watch. That's my view. Any other questions at all? Okay.